Okay, dear colleagues, now I want to tell you the approach, how to approach in cases where the patient is presenting with some joint pains. Okay, so uh, the joint pains are coming like hand pain, then like shoulder pain, neck pain, back pain, knee pain, and can be pain in the ankle joint or the big toe. Okay, so basically these are the different sites where the patient is having the pain and they are presenting with these type of pains. So whenever we have these type of the pains, the first thing what we have to do is we have to, after doing this onset, course, and duration, then first thing what you have to do is we have to differentiate whether it is mechanical type or inflammatory type of the pain by asking simple question. What do you think this pain is increasing by work or increasing by rest? So if it is increasing by work, it is mechanical pain. If it is increasing by rest, especially in the morning, so it is inflammatory pain. Okay. So if it is mechanical pain, then the differential diagnosis will be different. And if it is inflammatory type of pain, then the differential diagnosis will be different. So, for example, if it is mechanical pain and if it is affecting the back, so it could be mechanical pain could be because of trauma, tumor. Tumor could be primary or secondary. It could be because of osteoporosis leading to fracture. Okay, it could be because of Paget's disease or some pinching of the nerve. It could be because of achondroplasia. It could be because of disc problem like disc prolapse or infection in the disc, bursitis. Other infections like tuberculosis and brucellosis should also be considered. Then, important one is spinal cord compression. Sudden spinal cord compression, it's medical emergency. So the causes are either it is because of disc prolapse, patient is having a spinal cord compression, or because of some malignancy, or because of some infection, or because of trauma leading to fracture and leading to spinal cord compression. So in scenario of back pain, if it is mechanical origin, this should be differential diagnosis from outside. Then when we will go inside, then we can take the detailed history and we will confirm our findings during the history. But if it is like the inflammatory type of the pain, so we have to classify either it is seropositive inflammatory type of pain or seronegative inflammatory type of pain. So if it is seronegative, we have mnemonic like PA. P is for psoriasis, E for enteropathic, A for ankylosing spondylitis, and R for reactive arthritis. Okay. And if it is seropositive, then we have to consider rheumatoid arthritis, SLE, systemic sclerosis, and then polymyositis, dermatomyositis also seropositive, and then polymyalgia rheumatica. So these are the causes in seropositive. So going back to the history, so once you have the pathway that the patient is having mechanical type of pain, you will go with the differential diagnosis that I mentioned with the mechanical type of pain, but you will rule out the inflammatory type. If it is going in favor of inflammatory type of the pain, then you have to ask the question specific to that inflammatory type. So what are the specific questions? Is it associated with morning stiffness? Yes. So how long the morning stiffness is staying? If it is more than 1 hour, it is significant. Okay. Then whatever the site the patient is having, then you have to ask other sites, do you have any? Like this patient was having back pain, so you have to ask, do you have any neck pain or restriction of the neck movement? This is a very important question. And the next question is, do you have any shoulder pain? Do you have any elbow pain? Do you have any pain in your small joints or no? Okay. So like this, you can ask, and then the knee pain or any other joint, do you have any pain? Like this. So then you apply the Socrates, the remaining Socrates, the character. What is the character of the pain? So here it was dull and aching type of the pain. Okay. Then we have to ask, is this pain is moving anywhere from the site? It is moving to anywhere, that is radiation. So what did you notice? Is there any aggravating factor? Is there anything making it worse? Is there anything making it better? Okay. And then since it is started, how the time course, is it increasing or decreasing or same? Okay. Then the severity, 0 being no pain or 1 being minimum pain and 10 being maximum pain. So how much grade you will give? So you have to ask like this. So this will finish your history about the pain. Okay. Then you have to find out For example, if it is seronegative arthritis, then you have to find out whether it is really ankylosing spondylitis or it is one of the top most differential diagnoses for ankylosing spondylitis is psoriatic arthritis. Sometimes psoriatic arthritis, in 20% of the cases, they present only with the joint manifestation. The patient will not have any skin manifestation. So, but you have to ask the question. For this, you have to apply the mnemonic. Yesterday I told you, JELSAWS. So J for joint pain. Just now we finished the joint pain. Then you will ask E for eye. So you have to focus on the eyes of the patient, and you have to ask, did you ever have the eye redness or painful eyes? Yes. So it is going in favor of anterior uveitis. What you did and what the doctor advised, how long it was this problem was staying with you, is it coming and going, or it happened to use for some time only? Okay, then the rash. Do you have any rashes or skin changes? If he says or she says yes, then show me the rash. Okay, when you see the rash, ask some question related to the rash. Is it painful? Is it itchy? Is it oozing? Is it coming and going? Is it persistent? Any medicine for this? Did you ever see any skin doctor? What he advised, what medicine received, what you did. Okay. Then after the rash, you have W. In W, you can ask your water work. How's your water work? How's your was there any discoloration of the urine? Was there any reddish urine? Is there any changes in the amount of mixturation or the urination? So if it is going with renal manifestation and the patient is developing like renal failure, there will be decreased amount. If the patient is having pulmonary renal manifestation or joint together with, there could be features of decreased renal output. Or if some cases are related to proteinuria, like in this case also, if it is ankylosing spondylitis, one of the complications is amyloidosis. Proteinuria. So we have to ask, do we have any frothiness of urine? If yes, that goes in favor of proteinuria. Then W is also indicating the weight changes. In such type of cases, patient can lose the weight. Chronic conditions, seropositive, seronegative can lead to weight changes. So do you have any weight changes? How is your body weight? Losing weight, is this intentional or unintentional? Okay. Then A for anemia and A for abdominal symptoms. Anemia, as we discussed yesterday, did anybody told you that you are looking pale? Or did you check your blood level called hemoglobin in the recent past? If yes, what was the level? Was it okay or was it low? Okay. Then the symptoms related to anemia, if he is having or she is having positive anemia. So you can ask, do you have any difficulty in breathing while walking? Do you have any chest pain? If there is severe anemia, patient can have chest pain also and can have dyspnea on exertion also. Then do you have any bleeding from your orifice, any nasal bleeding, or any nasal deformity? Some conditions such as pulmonary renal associated with this. Any gum bleeding? Did you ever throw up blood? Did you ever cough up blood? So what was the amount and this and that? Then did you pass blood in your spoon? If yes, what was the amount and what was the color? Okay. In female, you have to ask about menstrual history, and then do you ever use any blood thinning medicine? These are the questions for anemia to find out the cause. Do you take balanced diet or no? Okay. So then A for abdominal symptoms also. How's your bowel work? Do you have any loose motions? Okay. Do you have any problem, any abdominal pain or no? So this will, okay. So I was talking about the L. L is for lumps and bumps. Do you have any lumps and bumps or no? Okay. Then S for shortness of breath. So any chest symptoms are there or no? Or any cardiac symptoms are there or no? So like this patient, if he is having fibrosis, he will have dyspnea on exertion. This patient is having kyphoscoliosis, so he will be having dyspnea on exertion because of restriction of the chest movement. His lungs on auscultation was normal as doctor examined in this patient. Then cardiac symptom, do you have any difficulty in breathing related to cardiology cause? Yesterday we have discussed this. So the journals will help you in making the review of system. So for review of system, you can use this mnemonic known as JELSAWS in cases where you have joint pain, where you have skin condition, where you have chest-related patients, where you have kidney-related cases, where you have abdominal-related cases. So if you will ask the question related to this, you will get some important hints from there.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.